Good morning, teacher. My name is Nga and my full name is Leti Nga. This is our group discussion. We're from group 1 and there are 4 members in our group. They are Nguyễn Thị Hoài Nam, Lê Thị Nga, Nguyễn Minh Phương and Hà Thị Mỹ Nhanh. Today we would like to present our topic of Unit 6 disease and it's about diabetes. So do you know what is diabetes? Diabetes is also known as diabetes mellitus. Is a chronic disease that occurs when the body does not produce enough insulin or does not use insulin effectively. Insulin is a hormone necessary for converting glucose sugar from food to energy. When there is not enough insulin, blood glucose level rise, causing various health problems. Currently, diabetes is not only affecting adults but also number of the children with diabetes is also increasing. So now look at the chart. We can see that the diabetes statistic. The first one is prevalence rate according to the World Health Organization WHO. In 2021, approximately 537 million adult ages 20 to 79 worldwide were living with diabetes. Future projections. The number of the people with diabetes is expected to rise to 643 million in 2030 and raise to 783 million by 2045. Mortality, according to WHO, diabetes is responsible for about 1.5 million deaths annually. And so how do you know you have a diabetes? So now look at the symptoms of diabetes, and if you have one of these symptoms, let's go to see the doctor and check it out that you have a diabetes. So the first one is excessive thirst, that you feel constantly thirsty and you drink a lot of water all day or all night. Number 2 is frequent urination, that you need to urinate often, especially at night. Number 3 is fatigue, that you feel tired, weak, dizzy, always. Number 4 is unexplained weight loss, that you lose weight despite normal eating habits. Number 5 is slow healing wounds. Wounds or infection take longer than take longer to heal than usual. And the last one is blood reason, experiencing vision problem. There are 3 main types of diabetes. Type 1 diabetes. Do you know what is type 1 diabetes? When the body does not produce insulin, it usually occurs in children and adolescents. Type 2 diabetes. When the body does not use insulin effectively, it is commonly found in adults and is related to lifestyle and diet. And gestational diabetes occurs during pregnancy, usually revolves after childbirth, but can increase the risk of developing type 2 diabetes later on. So now we're going to move to next part with Nguyễn Thị Hoài Nam.
Thank you, Ms. Nga. Hello everyone, my name is Nguyễn Thị Hoài Nam. Now I am going to talk to you about the causes of diabetes. What are the causes of diabetes? There are 3 main types of diabetes. The first, the causes of type 1 diabetes. Genetic factors. A family history of type 1 diabetes can increase the risk of developing the disease. Environmental factors. Viral infections of other environmental factors can trigger an immune response, leading to the destruction of beta cells. Immune factors. Certain abnormalities in the immune system can cause it to mistakenly attack beta cells. However, unlike type 2 diabetes, type 1 diabetes is not related to lifestyle or diet. The second, the causes of type 2 diabetes is type 2 diabetes is mainly caused by a combination of genetic factors and an unhealthy lifestyle. Below are some main causes. Obesity and overweight. This is the most common cause when the body has too much fat, especially abdominal fat. It can reduce the effectiveness of insulin use, leading to insulin resistance. Sedentary lifestyle, lack of physical activity decrease the body's ability to regulate blood sugar levels and increase the risk of insulin resistance. Unhealthy diet, consuming excessive amounts of sugar, saturated fat, and starches can lead to weight gain and increase the risk of developing type 2 diabetes. Genetics. If there is a family history of diabetes, your risk of developing the disease is higher. Age. The risk of developing type 2 diabetes increase as you age, especially after the age of 45. Polycystic ovary syndrome. In women, this condition is associated with an increased risk of developing type 2 diabetes. Stress and insufficient sleep. Continuous stress and lack of sleep can increase the risk of the disease by affecting metabolism and insulin regulations. The third, the causes of gestational diabetes. Gestational diabetes occurs when a pregnant woman's body is unable to produce enough insulin to meet the increased demand of pregnancy. There are some of the main causes. Hormonal changes. During the pregnancy, the placenta produced many hormones necessary for the baby's development. However, some of these hormones can reduce the effectiveness of insulin in the mother's body, leading to insulin resistance. To compensate, the pancreas must produce more insulin, but if it is insufficient, blood sugar level rise, resulting in gestational diabetes. Weight gain. The woman usually gain weight during the pregnancy, which can reduce the body ability to use insulin effectively. Excessive weight gain, especially in women who are already overweight before pregnancy, increase the risk of developing gestational diabetes. Genetic factors. If there is a family history of diabetes, the risk of gestational diabetes is higher for the pregnant woman. Advanced maternal age, the risk of gestational diabetes increase for the woman over 25 to 30 pregnancy to 30 years old, particularly after the age of 35. History gestational diabetes. The women who have had gestational diabetes in the previous pregnancy are at the higher risk of developing it again. History of delivering a large baby. Women who have previously given birth to a baby weighing over 4 kilograms are more likely to develop gestational again. These factors often combine, increasing the likelihood of developing gestational diabetes during pregnancy. That's all my um, that's These are the causes of diabetes. Now we are going to move to Miss Phương with complication of diabetes. Thanks for listening.
Thanks, Vietnam. Hello, everybody. My name is Nguyễn Minh Phương. Now I'm going to talk about the complications of diabetes, a chronic condition that affects millions of people worldwide. Diabetes occurs when the body unable to properly regulate blood sugar level over time. Elevated blood sugar can lead to serious health complications. These complications can be divided into two main categories: acute and chronic. The first, acute complications. Hypoglycemia. This happens when blood sugar never drops to no it can occur as a result of taking too much, easily skipping meals or excessing physical activity. Symptoms include dizziness, sweating, confusions, and in severe cases, loss of consciousness. Diabetes ketoacidosis (DKA) primarily affecting people with type 1 diabetes. DKA occurs when the body starts breaking down fat too quickly, causes acid called ketal to build up in the blood. This can be life-threatening if not treated. Prompting with the symptoms such as vomiting, dehydration, and deep, rapid breathing. Hypersomnolence, hyperglycemia, HSS, more common in people with type 2 diabetes. These conditions occurs when blood sugar never becomes increasingly high without the breathing. Uncatered symptoms include extreme dehydration, confusions, and seizures. The second, chronic complications. Long-term complications develop over time due to severe high blood sugar level. These can affect various organs and systems in the body. Cardiovascular disease. People with diabetes are significantly higher risk of heart disease, and stroke. High blood sugar can damage blood vessels and lead to the buildup of blood, increasing the likelihood of heart attacks and other cardiovascular issues. Neuropathy and nephrotic kidney damage and eye damage. The next, food complications and Alzheimer's disease. Now we're going to move Miss Nhan. Thanks for listening.
My name is Mỹ Nhan. I'm from Group 1. Today I will continue how to prevent diabetes. There are 5 ways how to prevent diabetes. Number 1, weight management. Controlling body weight by losing weight can reduce the risk of developing diabetes. The American Diabetes Association recommends that individuals with prediabetes aim to lose at 7% to 10% of their body weight to prevent the disease from progressing. Number 2, eating healthy fruits and vegetables. Whole grains and nuts provide vitamins, minerals, and are low in carbohydrates. The carbohydrate sources contain low amounts of sugar and starch, the primary energy source for the body, while being high in fiber, which offer numerous benefits in preventing diabetes. Number 3. Regular monitors blood sugar levels. In addition to the above prevention method of diabetes, individuals should also regularly check their blood sugar according to their doctor regarding timing and target blood sugar level. Keeping blood sugar levels as close to the target range as possible helps prevent or delay complications related to diabetes. And number 4, say no to tobacco. Smoking increases the risk of developing diabetes far by 15% compared to non-smoker, especially in women. Therefore, quiet smoking or never starting is essential for diabetes prevention. Individuals with diabetes should not smoke and should avoid areas where there is cigarette smoke. And number 5, avoid fat diets. Okay, thank you. Teacher, thank you for your listening.